Good day, everyone. Today we're going to discuss the current treatments for musculoskeletal injuries. But first, what is the musculoskeletal system? So the musculoskeletal system is a human body that provides our body with movement, stability, shape, and support for our bones, cartilage, ligaments, tendons, and connective tissues.
If an injury occurs, its known treatments are non-steroidal anti-inflammatory drugs, cryotherapy, and gene therapy.
We will discuss the said treatments in depth. First, let us define NSAID.
What are NSAIDs? Non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs, is a heterogeneous class of drugs that are known to have potent anti-inflammatory, analgesic, antipyretic, and antithrombotic effects according to the study of Carnu et al.
It is a large class of drugs that work by reducing the body's production of chemicals called prostaglandins, which trigger inflammation, fever, and pain.
In sports medicine, NSAIDs can be delivered orally, tropically, intramuscularly, post-operatively, or via intravenous preparations to treat soft tissue disorders such as joint injury, osteoarthritis, inflammatory arthropathies, fractures, and hematoma.
Athletes regularly take these drugs to prevent pain, continue athletic activities in spite of injury, or accelerate return to function after. If it is taken immediately before or after injury, NSAIDs are able to reduce musculoskeletal pain and accelerate the return of function.
So what is the process of NSAIDs? NSAIDs are able to block the production of certain body chemicals that cause inflammation.
They block specific enzymes like cyclooxygenase, which is used to make prostaglandins. These are hormone-like chemicals that contribute to inflammation, pain, and fever by raising temperature and dilating blood vessels, causing redness and swelling in places it is released.
So what are the advantages and disadvantages of using NSAIDs? Some advantages are that they aren't addictive, unlike other pain medications such as narcotics. They can fight the inflammatory process in the body as well as have the ability to be antipyretic. They can relieve symptoms of headaches, painful periods, sprains and strains, colds and flu, arthritis, and other causes of long-term pain, and is relatively inexpensive as compared to other treatments.
Some disadvantages include having unwanted effects like asthma, exacerbation, acute kidney injury, rectal irritation, heart failure, and skin irritation. It may also increase the risk of heart attack and stroke. It can cause ulcers and other problems in the intestine because it prevents the creation of prostaglandins and it reduces blood flow to the kidneys.
Now, what is cryotherapy? Another current treatment for musculoskeletal injuries is cryotherapy. It is also known as cryoablation, which refers to a variety of cold applications that can be used in multiple ways to effectively treat sports injuries. Treatment where extreme cold is applied to freeze and destroy abnormal tissue. It is also a minimally invasive therapy and removes damaged or diseased tissue that comes from a variety of medical conditions. Cryotherapy is done without open surgery and one can recover quickly from the procedure and with little pain.
Now, what is application to sports injury? Cryotherapy in sports injury management has been adopted so quickly by sporting teams and individuals. It can boost energy levels, increase the body's resistance to strain, and decrease fatigue. It helps to ease muscle tension, rapidly accelerate healing bruise, swollen or stretched muscles, and decrease the effect of delayed onset muscle soreness or DOMS, which are essential in maintaining overall health and condition of athletes. Cryotherapy is the modality of choice for acute injuries because of its ability to reduce blood flow to an area and reduce pain like in sprains, strains, subluxations, dislocations, contusions, and fractures.
So what is the science behind cryotherapy? When exposed to extremely cold temperatures, an emergency response is triggered within the body. This response limits blood flow to the core and releases a cocktail of hormones, including adrenaline and endorphins. The heart pumps harder and blood flows faster. Because the temperature in cryotherapy chamber drops so fast and affects the entire body at once, the response is more extreme. When we step out and begin to warm up, oxygen-rich blood is delivered around the body, boosting energy levels and giving a feeling of elation.
Most commonly, ice packs are used for cryotherapy because of its effectiveness, convenience, low cost, and ease of transportation. Ice is believed to control pain by instigating local anesthesia. Another tip for this treatment is that the most effective ice to use is crushed ice, as it conforms comfortably to the contours of the injured area.
Now we have the advantages and disadvantages of cryotherapy. For the disadvantages, it is minimally invasive and less painful. It reduces swelling and internal bleeding. It also reduces muscle spasm, and it acts as an analgesic, a numbing agent. It also enhances recovery times and increases overall energy. It reduces tissue metabolism.
Cryotherapy also has disadvantages. You may experience side effects such as numbness or tingling of the tissues, and also temporary redness and irritation of the skin. And next is that you may experience complications such as bleeding, cramping, or pain after cryotherapy around the cervix, bone fractures, nerve damage resulting in loss of feeling, swelling, scarring, and skin infection.
The last treatment for musculoskeletal injuries that we are going to discuss is gene therapy.
Gene therapy is a medical treatment that addresses the underlying genetic issues in order to treat or prevent diseases such as cancer, cystic fibrosis, heart disease, diabetes, hemophilia, and AIDS.
It also allows the medical doctors to treat a problem by changing a person's genetic composition instead of using drugs and surgery.
Gene therapy inserts DNA into a person's body to restore some function associated with a damaged or missing gene. It can successfully treat sports injuries like the muscles, ligament, and tendon ruptures, cartilage lesions, bone fractures, and others.
Now, what is the process of gene therapy? Fundamental to the process is identifying the gene in question, cloning it, and inserting it into the human genome that needs it. The gene that needs modification or replacement must be identified. Correctly functioning genes to replace defective genes must first be isolated and then replicated. A gene of interest can be isolated by attaching a molecular marker to the gene. The gene is then removed from the genome by a restriction enzyme that cuts the genome only at the base bond of interest. Genes removed from the genome can be easily replicated by PCR. PCR is the process of replicating the genetic sequence of a gene by introducing base pairs into the sequence along with replication enzymes that induce, cause, and proofread replication. Then, we need to insert the gene into the cell that needs it. This can be done in vivo or ex vivo.
The advantage of this gene therapy is that there are currently FDA-approved genetic therapies for people with Leber congenital amaurosis, a rare inherited condition that causes blindness, and for people with blood cancers, such as acute lymphoblastic leukemia or all, and diffuse large B-cell lymphoma.
Some disadvantages of using gene therapy can include that it can lead to serious health effects like toxicity, inflammation, and cancer. And it can be expensive as it costs $2 million per dose. There are also potential risks, including unwanted immune system reactions, the targeting of wrong cells, infection caused by the virus, and it may also cause tumors. Finally, there are also some ethical issues involved.
This ends our presentation. Thank you for listening, and for references, we use these articles to provide information regarding the musculoskeletal system.